is the Emergency Medical Minute.
Okay, we see a lot of EKGs here. We see a lot of EKGs from triage, especially when we're busy in the waiting room, and they get brought to us. And you know, sometimes the EKGs are even for chest pain or important things as well. So we see a lot of normal EKGs too. So across the board, probably about a quarter of the EKGs that are done are normal. And the computer, we were always kind of taught not to read the computer reading, but the computer is actually pretty good about reading a normal EKG. When it says it's normal, anecdotally and even with studies, it's invariably normal. So this study is kind of a real-world study that was done for the ER specifically to look and see, do normal EKGs really need to be brought to the ED docs? And the reason for it is because a lot of interruptions happen when you're giving an EKG. Many times you just come back from a room, you sit down, you're trying to put orders in, and you're given an EKG, and you kind of have to stop your task, resume your task, and that's when a lot of errors can happen, like errors of task resumption, and you can get kind of distracted, which is obviously the way of the ER. But I like the study because what they did is they took 855 EKGs that were done at triage. They ultimately, 222 of them were read by the computer as normal. They took those 222 that were read by the computer as normal, and they gave them to a bunch of cardiologists, and they had them take a look at them. And in the end, the cardiologist assigned 13 out of those 222 normal EKGs to some kind of abnormality or some kind of difference from the normal reading, and they were all very minor, very non-specific. And then they took those 13 and they showed them to two different ED docs, and they said, if somebody showed you this EKG, would you do anything about it from triage? And one of the EKGs was by one of the docs, not both of them. He said, you know, I put them in the next room and I take a look at them. And ultimately that patient was discharged from the ER, had a negative stress test the next day. So the authors concluded that a normal triage EKG may not need to be brought to the ED. And the reason being was that time-sensitive pathology is almost universally not going to be found by a normal EKG. And so the thoughts were, in a busy ER where there's already a lot of interruptions, just trying to help the workflow, trying to limit the interruptions. It might be something to institute a policy and say, you know, maybe if it's a normal EKG, we can just put it somewhere people can find it, and you don't have to see it right away. And that being said, you know, sometimes I think we kind of lose the main direction that we've gone with the cardiac walkbacks. The cardiac walkback, in reality, was made to get an EKG within 10 minutes. It wasn't made for somebody to rush in or a doctor to rush in for the same reasons, because you know, if a patient's sick, then by all means, you know, we need a doctor right there, right now. EKG's abnormal, or they have a good story, or they have abnormal vital signs, or they just look sick. But you know, you're 28-year-old with a normal EKG. The reason to get him back is to get that EKG. If it's normal, then we can see him in the kind of the normal workflow pattern. So I liked it.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.